visit a Best Buy Metal showroom or drop by bestbuymetalroofing.com to get a quote today. Best Buy Metals, roofing that lasts.
All right, Mix 1041 at mixtv.tv. Right now we are joined by Dr. James Gooden with Milligan Vein. Dr. Gooden, how are you?
I'm doing great today. Thanks for having me.
Of course, it is great to see you. So for folks who maybe don't know you, tell us a little bit about your background.
Right. Well, again, I'm James Gooden, and I'm a physician, a surgeon specifically, and I work at Milligan Vein Clinic. We treat vein disease, mainly affecting people's legs. But me personally, I'm from East Tennessee. I graduated from Central High School in Knoxville. I went to University of Tennessee for college. I did medical school at UT in Memphis, and I did my residency at Erlanger at one of the UT systems as well. So, and then after that, I moved on and I did general surgery and trauma surgery at the University of Tennessee Hospital in Knoxville for close to 10 years. And then about 3 or 4 years ago, I kind of made a shift in my career move and moved into doing vein care. So
we're talking with Dr. James Gooden with Milligan Vein. So when it comes to vein disease, what are some of the common symptoms that your patients come in for?
Right. So most commonly I see folks who are having some element of discomfort in their leg or leg pain. So it generally presents as tired, heavy, achy, swollen legs. A lot of times, when people think of vein disease, they think of just sort of the prototypical varicose veins, ropey-looking veins that we see, particularly during the summer months. But most of the patients I see don't necessarily have that. They have swollen legs that are tired and heavy, and they keep them from living, life to the fullest.
Is there a certain age group that you see more of?
I see folks in their 20s all the way up to their 90s, but the majority of folks that I see are in their 40s to 60s.
So what treatments are available there at Milligan Vein?
It's fairly simple. We do several different types of treatments. A very small aspect of our practice is cosmetics, and that really just deals with eliminating spider veins. Other than that, again, we're treating symptoms. We're treating pain. We're treating swelling and inflammation and that sort of thing. And really the sort of basis for vein care, at least surgically, is to identify veins that aren't working properly and somehow either eliminate them, get rid of them, or do what we call ablation.
We're talking with Dr. James Gooden with Milligan Vein. So what would you say to people who think that their symptoms are just part of getting older or just something they'll just have to live with?
Well, I would say that it's worth looking into, because quite frequently, if it is relatable, your symptoms are relatable to vein disease, I can improve your symptoms somewhere between 70 to 90%. On average, and that usually, if both legs are affected, we go through a process together. We have to do some medical non-operative management of your vein disease, just to fall in line with the guidelines and the insurance rules. That lasts about 90 days, and we do things like medical grade compression hose, elevating your legs, and just some lifestyle changes. Those are good in that they help us hone in on vein disease being actually the cause of your problems, while they don't really provide you with a permanent sort of solution to these symptoms. So that's where I step in, and after we've gone through that process, we go through the surgical treatment process, which, if both legs are affected, it typically involves somewhere between 2 to 4 20 to 25 minute treatments.
Again, we're talking with Dr. James Gooden from Milligan Vein. So final question for you here. What are some of the risk factors for developing vein disease?
Right. So the risk factors are, unfortunately, the biggest risk factor is genetics, and there's not really a whole lot we can do to modify that. And so, in essence, if you have genetics for stretchier veins, you're going to be more likely to have to suffer some form of vein disease in the future. Other risk factors, obviously, maintaining a healthy weight, and just being healthy in general can help. But exercise, A lot of people have the misconception that their jobs where they're standing on concrete floors for 20 years. I hear that a lot, and that's really not. That may exacerbate the pre-existing problem, but your job didn't cause you to get vein disease. And really, I guess the moral is that there's, it being mostly a genetic issue, just being able to identify it and seeking out help when those symptoms do arise.
So what is the best way for people to reach out and make an appointment?
Right, so you can call us at our number, and we'll post that. That's the easiest way. If you give us a call, I'm typically at our Cleveland office on Thursdays, and we have a we're able to get you fit in pretty much the very next visit once you give us a call.
All right, that's Dr. James Gooden with Milligan Vein. Thanks so much